Welcome to Health Radio Tech. Today's lesson is contrast media or contrast agent. Now, what is contrast media? In 1896, Walter Bradford discovered contrast media. In 1897, first reported GI contrast study was performed using bismuth, which was toxic. In 1910, barium sulfate was used, which is safer. In 1920s, sodium iodide was used to treat syphilis. Iodine was found to be radio-opaque to X-rays and is the basis of all modern contrast agents. In 1927, first reported IBA with iodized organic salts. Contrast is the difference in optical density between different parts of image on radiograph. It depends on the density of different tissues. This is chest X-ray. Notice the difference in optical density? Inside the lungs look black. Why? Because that space is filled with air, while the bright white parts are bones. Bone is denser than air. This is an X-ray of a patient with metal implant. The metals look whiter than the bone. Why? Because metal is denser than bone. Soft tissues in the body such as organs and blood vessels are less visible on a radiograph due to their density. Therefore, a contrast agent or media is given to a patient to make them more visible on a radiograph for proper diagnostic purposes and treatment. It is a chemical substance that increases the density of the organ under examination. A substance which, when introduced into the body, will increase the radiographic contrast in an area where it was absent or low before. Contrast materials, also called contrast agents or contrast media, are used to improve pictures of the inside of the body produced by X-rays, computed tomography, CT, magnetic resonance, MR, imaging, and ultrasound. Often, contrast materials allow the radiologist to distinguish normal from abnormal conditions. Contrast materials are not dyes that permanently discolor internal organs. They are substances that temporarily change the way X-rays or other imaging tools interact with the body. When introduced into the body prior to an imaging exam, contrast materials make certain structures or tissues, tumors, lesions, bleeding, etc. in the body appear different on the images than they would if no contrast material had been administered. Contrast materials help distinguish or contrast selected areas of the body from surrounding tissue, helping physicians diagnose medical conditions. Contrast materials enter the body in one of three ways. They can be swallowed, taken by mouth or orally, administered by enema, given rectally, injected into a blood vessel, vein or artery, also called given intravenously or intra-arterially. Following an imaging exam with contrast material, the material is absorbed by the body or eliminated through urine or bowel movements. Leaves the body within 24 hours if normal kidney, and weeks if diseased kidney. There are several types of contrast materials. Iodine-based and barium sulfate compounds are used in X-ray and computed tomography, CT, imaging exams. Contrast materials can have a chemical structure that includes iodine, a naturally occurring chemical element. Barium sulfate is the most common contrast material taken by mouth, or orally. It is also used rectally and is available in several forms, including powder, which is mixed with water before administration, liquid paste tablet. When iodine-based and barium sulfate contrast materials are present in a specific area of the body, they block or limit the ability of X-rays to pass through. As a result, blood vessels, organs and other body tissue that temporarily contain iodine-based or barium compounds change their appearance on X-ray or CT images. Gadolinium is the key component of the contrast material most often used in magnetic resonance, MR, exams. When this substance is present in the body, it alters the magnetic properties of nearby water molecules, which enhances the quality of MR images. Saline, salt water, and gas, such as air, are also used as contrast materials in imaging exams. Microbubbles and microspheres have been administered for ultrasound imaging exams, particularly exams of the heart. Arteriography, angiography, cardiology, venography, replaced by ultrasound Doppler. IV. Fluoroscopy, alimentary tract. Hysterosalpingography, HSG, scilography. CT. MRI, Ultrasound, liver, kidney. Myelography, replaced by MRI. Arthrography, for knee joints. Metal taste. Feeling of warmth. Contrast materials are safe drugs. Adverse reactions ranging from mild to severe do occur, but severe reactions are very uncommon. While serious allergic or other reactions to contrast materials are rare, radiology departments are well equipped to deal with them. Products like juices containing manganese, for example blueberry juice, pineapple juice, can be used as contrast media. Thank you. Don't forget to subscribe for more videos from Health Radio Tech.